Hi everyone, welcome to Beyond Your Knowledge. So now we're going to be studying here the lymphatic drainage of the lower extremity, and before that, so I would like to share with you Revelation 3:20, and Revelation 3:20 says that behold, behold, I stand at the door and knock. If anyone hears my voice and opens the door, I will come in to him and eat with him, and he with me. So this is the word from Jesus saying that. Okay, so now we're going to learn about the lymphatic system. Is super big. Okay, so but we're going to limit it to the lymphatic drainage of the lower extremity in this video. Okay. So but before we continue, I would like just to mention here, so how is the lymphatic system looks like. Okay, so this is a lymphatic system. Let me just put it a little bit small. Okay, so there we go. So here we have two systems. So we have the circulatory system and we have the lymphatic system. Now we're going to see some information that the lymphatic system, if we're talking here about on the extremities in this area here, if we're limited to this area here, to the extremities, so the lymphatic system there, so lymphatic system in the extremities, we can divide it in superficial lymphatic vessels. Okay, and now probably you're saying, but why you put a picture of the circulatory system? Has as a purpose to do, because the superficial lymphatic system run with the vein system. Okay, so the vein system is the one that is in blue here. Okay, so this one that you see in blue here, yeah, so basically that one, they run together with the venous system. Now the deep lymphatic system, we saw the superficial run with the venous system. Now the deep venous system run with the with the arteries, sorry. Yeah, so run with the arteries, which is also known or arterial system. Okay, so it doesn't matter. So it the arterial, which is this red one, just the red one. Okay, so with the arterial system. Now now, but those superficial vessels that they run with the vein system, they are going to receive lymph from the skin and the subcutaneous tissue. So that means that if you have here your skin and you have your subcutaneous tissue, and then those two, the skin and your subcutaneous tissue, is going to drain in the superficial lymph system. Okay, in the superficial one, and the superficial one is going to run to the venous system. They run together. Now we can continue. While the deep vessels of the deep vessels drain in, while in the deep vessels of the lymph, who is going to drain? So it's going to be the muscles and the superficial vessels. Okay, let me just say it better in another way. We saw that the skin and the subcutaneous here drain into the superficial lymph nodes. Now who is going to drain into the deep lymphatic system? So it's going to be the muscles, is one of those, and also in addition to the muscles, the superficial vessels. So those two, the superficial vessels. Okay, I think that now probably is more clear. Now I'm going to show you a new picture. So basically this is the lymphatic system again, but to understand or to go a little bit more deep, so we're going to again focus here into the lower extremities. Okay, so we're going to focus here again into the lower extremities. So what's going on here? So in the lower extremities, remember that the superficial lymphatic system, with that is the one that is going to drain into the veins that we saw here, so into the venous system that we saw here. So now this is superficial, so we can divide it in two. So what are those that we're going to divide it? We're going to divide it into the medial and into the lateral tracts. Okay, into the lateral tracts. Now this one, the medial tract, this one that is here, so runs along with the saphenous vein. Okay, so with the saphenous vein. So I will show you the vein system here. So we have here the great saphenous vein, which is by the superficial system, and also the small saphenous vein, which is by the superficial system as well. Okay, so now we can come back again, because that one, the medial tract from the lymphatic system, so it's going to run through the saphenous vein that we saw in the previous picture. Well, now this one is going to be so go through the saphenous vein, as mentioned, to the superficial inguinal lymph nodes. Okay, now it's going to be passing through the popliteal nodes. But what are those popliteal nodes? Those nodes are right here. Do you see? Yeah, they're going to be passing right here. Okay, now if there is a lesions on the medial foot that cause the inguinal lymphadenopathy, so by your foot, if you have a lesion here, it's going to cause medial lymphadenopathy. Okay, and now how you know? So if you have a lesion here, so you have a lesion in your foot, okay, and then so how you can figure out? So if you have this lesion exactly in the medial foot, so you are going to check those go traveling through parallel to the saphenous vein, all those, but it's going to drain into the popliteal lymph node. So the patient is going to have a lymphadenopathy in that area. Okay, now with that in mind, we can well, if the patient has a lateral instead of medial, now the patient has a lateral lesion, what's happened? So if the patient has a lateral lesion, this one is going to drain into the lateral tract. Okay, right there, lateral lesion into the lateral tract. Okay, and this one communicate with the popliteal and inguinal nodes. Okay, and also can cause lymphadenopathy in the popliteal, but in addition to the popliteal, is going to have lesions in the inguinal lymph nodes. If you have a patient who has the lymph nodes has a lymphadenopathy in the popliteal, when you check the popliteal area, which is behind of your knee, so in the back of your knee, if you check there and then you check in the inguinal area, the patient could have any bump or something, so you need to suspect that the patient has a lateral lesions in the feet. But if it's not in the inguinal, so it's just in the popliteal, so it does, yes, so basically it doesn't have the lateral lesion. I would like to mention a correction I just noted. So here I mentioned that if the patient has a lesions in the medial foot, okay, so I mentioned that is going to have a popliteal infection. I mean, it's going to be this one popliteal and the inguinal. But yeah, it's not popliteal in that case. It's going to be just the inguinal. So we're going to erase this one here. Okay. So yeah, so it's going to be just in the inguinal. Now, if the patient has the lateral is going to be inguinal and popliteal. Okay, so this is for lateral. So I'm going to write it down here. So lateral foot lesion. So the patient has two lymphadenopathy in those two places, which is the popliteal and the inguinal. Okay, and now if it's in the medial foot lesion, so it's going to be just in the inguinal. Okay, in the inguinal nodes, lymph nodes, just be clear, lymph nodes. Okay, so basically is that, and remember that we need to keep studying, and thank you so much for watching, and God bless you.